Hi, my name is Cassidy Lee, and today I'm going to be presenting over genetic abnormalities. So, what is a genetic abnormality? Well, a genetic abnormality is defined as a disease or disorder that is inherited genetically. You can also find other terms for genetic abnormalities, and some of these can include genetic disorder, congenital disease, and genetic defect. Often, when you see talk about a genetic disorder, you'll see the words abnormality, disorder, defect. Congenital is also used a lot in general. So, there are three main types of genetic disorders. There are a single gene genetic disorder, and this is where the mutation affects one gene. There is a chromosomal disorder, and this is where the chromosomes are changed in some way, such as they're missing or there's multiple of them. It could also just affect a part of the chromosome instead of like the entire one. And then there's a complex disorder, and this is where the mutations are in two or more of the genes instead of one, as in a single gene disorder. So I'm going to talk about some of the more well-known common single gene disorders. Single gene disorders affect approximately 1% of the entire population. So, cystic fibrosis affects the cells that produce mucus, sweat, and digestive fluids. Cystic fibrosis causes these cells to make all these substances thicker and sticky, which damages the lungs and the digestive system. It's also abbreviated as CF. Then there's hemochromatosis. This is where you have an iron overload in your system. Hemochromatosis mostly causes other really bad things within the body, such as cancer, irregular heartbeat, and cirrhosis of the liver, which not very good. Tay-Sachs disease. This causes a fatty substance to form in the brain, and it disturbs nerve cells within the brain and the spinal cord. Typically, you can see symptoms develop in children in about 6 months, and the disease will kill a child by the age of 4, typically. There have been links to certain ancestry with Tay-Sachs disease, and that nobody's exactly sure what's causing it. It's just typical, like certain ancestry has been linked to it. And then the final single gene disorder I'm going to be talking about is sickle cell anemia. This is a group of disorders, and it causes misshapen blood cells. It's called sickle cell anemia because it forms in like a sickle shape, like what you would see death carrying around typically. These blood cells die quicker, so the immune system is a lot weaker and it causes blockages. Um, I'm going to talk about common chromosomal disorders. About one in 150 babies are born with some form of chromosomal disorder. One of the most common disorders you'll hear about is a chromosomal disorder, and that is Down syndrome. It's also known as trisomy 21. It occurs when there's an extra copy of chromosome 21. The mother's age is a possible factor, and it can be detected by blood test before birth. The major problem with Down children affected babies is that they can have intellectual and developmental issues because of it. Klinefelter syndrome is when babies are born with one or two extra X chromosomes. This means that they will always be male because women are the ones who carry a Y chromosome. Usually it's not very detectable before puberty because it's some of the things that happen during puberty is what makes it telltale, like men will develop breasts if they have Klinefelter syndrome. Um, then there's Turner syndrome. It's almost like the opposite of Klinefelter syndrome. Babies born with Turner syndrome lack one of their X chromosomes and they are always female. Diagnosis can be made earlier in life than you would be able to with Klinefelter syndrome, and some of the symptoms can include short stature, infertility, and skeletal deformities. Um, so, what is a complex gene disorder? The third type. Complex gene disorders are actually more common than you would think. These include some of the things that you may even be affected with, such as asthma, diabetes, and heart disease, just to name a couple. They're named after the fact that multiple genes contribute to the development of the disorder, so they're also called a multifactorial gene disorder. Approximately 25% of all congenital diseases are caused by a multifactorial disorder. And then caring for children with genetic abnormalities, they typically experience increased difficulty in particular areas. Um, it's important for parents to try to use certain therapies such as management strategies, occupational therapy, and speech therapy to help their children develop as normal. Although sometimes it becomes out of their control, and it is important to realize that it's okay to go to a professional to seek therapy for additional help. Thank you.